AmeriPlan.
Yes, that's right.
Now, how did this come into being?
Well, actually, there are two twin brothers, Dennis and Daniel Bloom. They are founders of AmeriPlan USA, and they got started some 15 years ago. And actually, their market were CPAs, because they found a lot of independent contractors like that did not have dental coverage. And they started off as a basic dental plan. But it received it, and they enjoyed so much success, they subsequently expanded until now we have dental, vision, prescription, and chiropractic. And within the past year, they did a national rollout that contains a medical component. And I tell you, it's just really great. It allows people to access good quality health care.
And you got into this in what respect? You have not been practicing medicine.
That's true.
Or law, or any particular business activity. What drew you to work with the Bloom brothers and ultimately Dr. Walker himself?
Well, I tell you, that's interesting. As a matter of fact, I'm currently the CEO and president of Nature's Option International. It's an international health and nutrition company, and we were looking for some insurance coverage for a couple of our part-time employees when we ran across the AmeriPlan brochure. And after examining that, I was so impressed, but my time didn't allow me to do the due diligence, so I handed everything over to our corporate attorney. He was so impressed, he signed up all of his employees. So I subsequently flew out to Dallas to kind of really take a look at it. And the more I looked at it, the more impressed I became. As a matter of fact, a good friend of mine, Les Brown, a motivational speaker, was the keynote speaker there, and he had a lot of complimentary things to say. I was impressed with the infrastructure the company had. They had strategic relationships with Walmart, Walgreens, Sears, JCPenney's, but I saw that this plan was for real. My attorney was so impressed, he signed up as employees, so we made a decision that we were going to let as many people as we could know about AmeriPlan, because it definitely was affordable for the masses, and that's why we got totally involved to the extent that we're doing it full-time now.
Well, your commitment and your sincerity is brought about through your investigation and experience and the relationships you've developed with provider access organizations. So the AmeriPlan was good then, and it's good now, and it's still growing.
Yeah, that's a true statement. In fact, it's getting better all the time. Dr. Richard Walker, who we had the pleasure of speaking with a few minutes ago, actually he's licensed in 3 states, and that's Texas, Michigan, as well as New York. And I tell you, he's really enlightened me as to, is showing us that this is the way of the future. You know, we call it, this is a provider access organization, and AmeriPlan is leading the way. We call it consumer-driven healthcare. It seems to be the way of the future now, because so many people, they just can't afford the high premiums that are being charged by a lot of these insurance companies, and people know they need the coverage, but they can't afford it. And here we come with a program like AmeriPlan, where for basically just dollars a day, a person can provide protection for their entire family. So we're excited about it. The company did about $100 million last year, so it's really enjoying success.
Well, I was just at a meeting today at Local 245 UAW, in which they went through a program, and I am now having to tell them that the Medicare premiums are going up, even higher, and that costs are still on the rise in the industry. Hospital stays are more expensive, and we're finding out that a large percentage of the people that have to file bankruptcy are doing it because of their medical expenses, their hospital expenses that create so many problems. Then in addition, we find that the United States, we rank 37th in terms of quality of health care to the overall population. And that takes into consideration something that's very curious, and that is the fact that we have the best research in the world going on in America We have the best laboratories. We have the best training systems. Well, we have more innovative activity going on collectively than any place on earth, but it's not available for everybody. It's only available for those that can afford it. Now, if your last name is DeVos, you don't have any problem. But if your last name is Jones or Scott, you could have some very big problems, because these hospitals that will take you in, sometimes on an emergency basis. But I've had constituents that have come to me, and guess what they've told me? They went into a hospital and they come out with a $12,000 bill, for which they don't have any insurance. And as you know, 47 million people in the United States don't have a dime's worth of insurance. And some 20 million people, more than 20 million people, now have insurance, but they're underinsured, and they won't know it until they go into the hospital, and the problem that they're having is not covered in their insurance policy. It's a tragic situation that's only getting worse. Now, my question to you is this: what can we do, and can the plan that I have 74 other members of Congress joining with me on, which is House Resolution 676, a universal health care provision that covers everybody from the moment they're born? You get a card that will allow you to get the health care that you need as long as you're in America, without reference to how much you pay. I mean, well, it is on a sliding scale, but if you are improvident and unable to pay, then you do not have any payments, and there are no co-payments, there are no deductibles. And I'm trying to see if the AmeriPlan, which has been in effect for 15 years, can dovetail and relate to this universal health care plan, which has not been enacted yet, but we have national health plans in most of the industrialized nations in the world, including Canada. Now, what's the relationship? What's the possibilities of hookup? And this is what Dr. Richard Walker and I will be talking about, and this is what you and I, Mr. Scott, can begin to feel our way out and around and see what's happening.
Yeah, well, I really appreciate the fact that you understand and you identified a very serious problem. The health system is in need of repair. And
it's broken.
Yes, that's a great way of
and
saying
it may not be repairable, as a matter of fact. I hate to interrupt you.
Yeah, no problem, but I understand it. And that's why, I think it's ingenious that the founders of AmeriPlan has made a commitment to do what they can about it. And they've been helping so many people, thousands and thousands of people. And just to give an example, one of our associates, Scott Miller, out of Cedar Rapids, Texas, signed up for a membership, and within 72 hours had a severe heart attack. And then he got a bill for about $133,000 and didn't have any traditional insurance at all. And like I was saying in the speech I did not too long ago, a lot of people don't know that hospitals can be worse than Internal Revenue Service. They do the work, they want to get paid. So if he had not had anything, if he did not have AmeriPlan, they would have attached his home, his cars, and everything. But thanks goodness that he purchased this $59.95 a month plan, that he was able to get the AmeriPlan Health, and that plan allowed him to get that bill discounted, some $85,000 plus, and he only had a balance of about $33,000. They arranged for payments on that. Now, if he had not had that, I shudder to think the condition, anxiety that his family would be suffering now. But this is just one of many examples we have, because no matter how good something is, if people can't afford it, it lacks value. But here, what these programs do, they found an ingenious way to make it affordable for the masses. So for $59.95 a month, AmeriPlan has a way that a person can get significant access to quality health care. And so that's exciting to us. And, you know, another thing you said, this is a report by Dr. David Satcher. I know he was former...
He's a good friend of mine.
Oh, excellent. I know served as former Surgeon General.
Surgeon General of the United States.
He published many articles about why it's so important for people to get good dental care. And a lot of people don't know it. If you don't take care of your mouth, there's residual effects like all the way up to low birth rate babies and everything. And many times these mothers, they don't get the proper care for their children because they can't afford it. And
right.
It's programs like this that allow people to access good quality health care. Yeah, it's great, and I'm so glad that you're looking into doing what you can to help our health system. Like you say, we don't know if it's repairable, but in the meantime, it's programs like this that allow our people to access good quality health care. And I think it's not even a luxury now. This is a necessity.
I'd like to carry on this discussion with a number of people around the country that will be coming to Chicago after the election, of course, and we're urging everybody, if you have any interest in health care, and who isn't interested in their own health care, I would like to invite you to meet with people that are coming in all over the country that share the same enthusiasm and commitment as you do about bringing superior systems of health care to the American people. And we want to put on the table our ideas. We want to compare possibilities. We want to analyze systems. We have to approach this from a very scientific, logical, and rational basis, because there's been so much exploitation of the healthcare system by people who are only looking at how they can increase their own personal circumstances. That this issue, a national issue, has come to me, and this is the largest piece of social legislation that I've ever undertaken, and it's really big. As you know, we do $1 trillion worth of business in health care, and we're trying to get this program restructured, and we're in a race against time, because the longer we take to get this fixed, the more vulnerable not only seniors and children are, but all of us, our whole population. And it's very important that we understand that the sooner we repair this, the healthier we'll all be, the longer we'll all live, and the more we will enjoy our life.
All right, you're so right, and I'm with you on that, and I will arrange my schedule, and I'll check with Dr. Walker. We'd love to give any input that we can.
Thank you.
To help everyone in this endeavor. You know, there's so many residual effects from this. Like, you know, here's a report here that shows how health benefits, as health benefit costs increase, firms stop hiring because they can't afford. All companies want to do nice things for their employees, but if they can't afford it, the bottom line does not support it. That's why more and more companies are going to these provider access type organizations. And AmeriPlan is leading the way. It's the oldest and most successful company of its kind. So my wife and I, who's been associated, Deborah, she's been with Blue Cross for some 14 years, but she's full-time with this now. We're just committed to helping people access the health system in a way that they should. So I thank you for listening, and I tell you, maybe we can jointly do something of significance together. I'd definitely be happy to give my input at any point in time.
Well, your enthusiasm convinces me that you really want to take care of this problem, and it's very important that we do. We should thank R.J. Watkins for the opportunity of bringing us together.
Yes.
You know, this station does so much important public interest activity that you can't even begin to thank them enough for it. And the services that they bring to listeners, and of course they're affiliated with other radio and television connected operations, so it's very hard to estimate exactly how many people we're reaching. But I know that we're reaching a growing number because as I listen to these programs, people are calling in all the time. People are coming in all the time. Elected officials are now beginning to come around here more often because they want to get their message out. And the public service interest of this radio television organization can't be overestimated for the services that they do.
I totally concur. As a former educator, you know, communication is so key and so important, and people need to have access to good communication, good objective communication. RJ has always been standing out there and leading the way to make sure that we get access to information, because that's the first part of solving any problem is having good information. So I applaud him, and in fact, the entire community do. So
I'm hopeful, you know, that out of our conversations and your continuing appearances, that we will begin to have more people calling in, telling us about their personal health situation. We don't need their names or addresses. What we need to know is what is their medical circumstance, what obstacles are in their place. And this whole idea of going to the emergency room to get some help is a good thing that ought to be eliminated, because people ought to be able to go to a doctor and spend time. When you go in an emergency room, it's just what it says. Exactly. It's for emergency. It's not for continuing treatment.
That's right.
And you don't, the doctors on duty are under very stressful circumstances, and you don't know when you're coming back if you go into emergency. And so you would think that the most powerful, wealthiest nation in recorded civilization could do something more. We have 300 million people in this country as of this week. Now, 47 million of them have no insurance. And then 20-something million are underinsured. So we got a problem.
Oh, it's no doubt. And that's why I feel so fortunate to be affiliated with this company, because they're so committed, and they actually have infrastructure. They have an organization in place that we are right now helping people. So people can call us and we can show them how they can get up to 50% off on doctor visits immediately with no waiting period. We can show them how they can save up to 80% on dental services. And the good thing about it, we have virtually no waiting period. So I love it, and I just enjoy talking with you. And I think I'm going to be optimistic and say, hey, we're going to be able to help a lot of people. But yeah, we want to hear from you. We want to be able to let you know how we can best serve you. And I think the future is bright. We want to offer people hope. And we want to know that somebody is listening to them and somebody is working to help them.
When we meet in Chicago, I'm going to be inviting a number of the 76 members of Congress that are already on House Resolution 676, which is now in its at least fourth year. I've been working on a plan to insure medically everybody in America, because we're working from the premise that health care is a right and not a privilege. Franklin Delano Roosevelt came across these ideas that there were certain things in America that, even though they may not be in the Constitution, the right to housing, the right to medical care, the right to an education, if you have to put those in the Constitution, we've got something wrong with our economic system. And so it's in that spirit that I read this incredible article by Dr. Richard Walker, which is called Your Business, and it was in the August edition just 2 months ago, and it was a revelation to me and a miracle that thanks to R.J. Watkins, that Mr. Scott and Congressman Conyers could be talking to our greater listening audience tonight about such a vital and important program.
So it's been wonderful. It's been my pleasure. And like I say, I look forward to having many more discussions, and we're going to get something done to help the people.
I'll shake with you on that. All right. Pleasure.
This is R.J. Watkinson. We're here with the AmeriPlan team. This is
Deborah Scott,
Jerome Scott,
Daniel Bloom, Dennis Bloom.
These are the two individuals that they've been talking about all evening. These are the leaders of Detroit. And Jerome, you know, I've been knowing you for a long time, and all I know that you make things happen, Jerome.
Well, I try hard. I'm fortunate enough to be surrounded by really a lot of good people. And now that I teamed up with a corporation that's second to none, with that kind of support, that's why they call this convention The Sky's the Limit. Anyone that gets on our team, the sky truly is the limit.
Now, I understand that now. I received a memo in the box earlier today that you were teaming up with TV33 and WHPR, that we're going to do something very big with AmeriPlan. Tell me a little about something, Deborah. Tell me, Jerome.
When the calls start rolling in and the health plan just began, we know that AmeriPlan is going to take, we're going to take it to another level with AmeriPlan Health.
Okay. And we also plan to go on the network and national stuff and things like that. But Jerome, the crowd is here, and great team, great leaders, great people. What can I say, man? I mean, you are the guy, Jerome. You're that guy.
Well, the only thing I can say, you know, in this kind of business, your success is predicated on the success of others, and we have some wonderful people behind us. So the sky really is the limit, and I always said those that figure out a way to disseminate the information to the masses are going to win big. We're so fortunate to have a marketing system that allows everyone to participate if they choose to. And just to see senior citizens, people barely 18 years old, doesn't matter whether you're male or female, doesn't matter about your educational background, we have an infrastructure that is in place that can help everyone win with AmeriPlan, in addition to being a blessing to the people.
Good. Now, you've been talking about Jerome all evening. Now you have him face to face. Did you really mean all the good things you said about Jerome earlier?
Well, I tell you what, Jerome has been a real success at AmeriPlan. I recall when him and Deborah first came aboard with us. You know, he's a very experienced network marketer, has been in the industry for 20, 25 years plus. When he saw AmeriPlan, he recognized the real opportunity of residual income, and that if you built this business one time, then it would pay you year after year after year after year. And these folks have financial freedom with AmeriPlan. Right, Jerome, Deborah?
You're absolutely right. And the good thing is not just us. It's so many people across the United States now. And I tell you, this thing is just getting started now. Yes.
Absolutely.
Now, what would you say about Deborah, the lovely wife?
She's a beautiful woman, I'll tell you what. No, I want to take this opportunity to personally congratulate Jerome and Deborah. What an outstanding job they've done here in Detroit. They are the leaders here in the Detroit market for AmeriPlan, and we certainly appreciate everything that they've done. They really typify what AmeriPlan is all about. They really set the example. They really help people, not only from a benefit standpoint by getting them into the plan, but also by bringing them into the business and mentoring them into the business to develop financial freedom. And we really do. We really congratulate them, and it is our pleasure to have associates like Jerome and Deborah Scott. Congratulations, Jerome.
This is R.J. Watkins saying thank you for watching, thank you for tuning in. Call the number on your screen and get in touch with Jerome and make it happen.